21st Century Oncology, our mission is to provide academic level medicine in a community setting. The way we do that is by having all of the key oncology specialists work together with us as the provider. We call that the integrated cancer care model. This coordination is highly relevant to a patient for two reasons. One, the physicians that are involved in that patient's course of care are able to work in a much more collaborative fashion. Two, the way our payer system is developing, patients are increasingly responsible for the cost of their care. And by having all of that coordinated in one administrative activity, we're able to relieve some of that burden for the patient. What we've observed over time is a marked increase in patient satisfaction, really driven by the level of engagement, because they're able to work with the key physicians and work with them in a very timely fashion. For the payer, what this allows is single accountability, because all of the physicians that are involved in that course of care are part of one payer relationship. The most important aspect of our administrative function is to relieve the physicians of administrative burden. So by having the integrated cancer care model, we're able to actually coordinate benefits, we're able to coordinate registration, and we're able to support the physician, all things that result in them being able to spend more time with their patients. What's so important is that this is a very sustainable model. I say that because we provide great care to our patients, and for payers, we provide a low-cost setting with strong evidence-based clinical pathways.
I joined this company in 1998. When I moved to Southwest Florida, my total goal was to develop a collaborative care effort. When the opportunity came about to really collaborate with intelligent docs in a forceful way to bring better outcomes, improve quality of care, lessen patient stress, you had to join. You had to put this together.
What I like about our organization, that first of all, it's run by doctors. We can spend almost 100% of our time doing what we do best, being physicians.
How 21st Century Oncology embodies the integrated cancer care model is predominantly through the identification of exciting new therapies for cancer, and by identifying among our physicians those champions that will help develop the implementation of these new technologies. First in radiation oncology, but now we're doing it for the other disciplines that work with us.
The integrated cancer care model simply says it's patient-centric. That is, it revolves around the patient and not around the hospital, and not around the physician, and not around the treatment. But it takes the patient as a whole and allows he or she to look at all aspects of the care. So patient-centric care is where it has to be, because that will give us the best outcome.
We feel very strongly that the patient experience has to be absolutely optimal. The company is able to bring together, under one umbrella, all the specialties in medicine that have anything to do with care of the cancer patient, in order to coordinate and develop an overall treatment plan that may involve surgery or radiation therapy or chemotherapy in this highly integrated fashion that gives that patient a sense of confidence that they're receiving a level of care that is commensurate to what they would get at the university hospital. We're able to provide that level of clinical integration at a greater number and more convenient set of locations so that the patients can access this level of care. I think that combination of integration clinically and geographic distribution in a given market makes us unique.
The integrated care model really allows a large group of physicians to collaborate amongst themselves as well as other institutions. They're able to work with hospitals, they're able to work with other healthcare systems, they're able to work with insurers. So they can really offer the product that men and women want.
The fact that next door to my office there is a radiation oncologist, and the fact that right upstairs there's a medical oncologist, and the fact that we have a nutritionist, and the fact that we have a radiologist and a pathologist, all of them working with us, we have this ability to do a multidisciplinary approach to cancer and take better care of our patients.
One of our challenges as a large company that provides multiple disciplines of cancer care is how do we harmonize the quality of care across many different offices and settings and disciplines? And the way that we've done that is through the use of electronic data management systems that we've developed that informs our physicians at the point of care about the level of quality of the treatment they're ready to prescribe for their patient.
Cancer is a very scary thing. And I think what all of us want to do is to deliver the type of care that we would deliver to our sister, our mother, our father, or our brother. 21st Century Oncology does that.
The most telling comment to me has been from the patient who tells me that I wasn't aware that this level of technology, this level of service was available in this community. I thought that I would have to go to New York City or Boston or Chicago to get access to this, but I'm getting it here. That tells me that we're succeeding, and I know that the company is delivering on its promise.
Seeing my patients, seeing them doing well, taking good care of my patients, being able to deliver good medicine, that's what drives me. Patient care and integrity, that's what 21st Century Oncology is all about.
Well, if you come here, you've got the best of the best. There's not even a question. I credit certainly my survival to this amazing organization. They are truly amazing.
I am the CEO of 21st Century Oncology by first and foremost, I'm a practicing physician taking care of very sick patients with very serious problems. I think one of the important features of 21st Century Oncology is that this is a physician-led organization. We are day in and day out in the clinic, taking care of patients so we can see what the real issues and the real problems are. In creating the ICC model through 21st Century Oncology, we offer the patient a convenient, coordinated, organized way of getting their health care. 21st Century Oncology is about bringing value. Value defined as excellent quality in results, in outcomes, in satisfaction, yet producing them in low-cost settings. What sets 21st Century Oncology apart from everybody else is its relentless pursuit of great medical outcomes, the best technology, and the ability to make sure that that technology and that know-how and those pathways diffuse through a very wide platform to make sure that the patients in West Virginia get the same treatment as the patients in Miami or in California. The model has been very successful with huge degrees of satisfaction by patients, by payers, by hospital systems that work with us, and by physicians who participate in the program.